Dr. Justin here. I owe you guys a golden hands demystification video, so that's what this is. Before we get to that, we have at least one order of business that we need to talk about, starting with this beard. So what's up with the beard? The beard is I had a really bad dental infection. I didn't get to eat solid meals for 7 days. So the beard is to help hide some of the weight loss that I had. And while I was so sick, I actually ended up working a couple of days and I worked without talking. So I was a mute. I could not talk to patients, and it was actually sort of liberating. You might have heard there are blind acupuncturists that work in Japan. So I wasn't blind, I had my sight, but I didn't have my voice. So it was a very interesting thing to work like that for me. So that being said, while I was sick, during one of the treatments that I did, I was treating one of the new case studies, Vermilion Orange. And while I was treating her, she told me that I had golden hands. So she was comparing me to her father, who was a tailor, an old school tailor, who could basically make anything whatsoever. Just give him the fabric, tell him what kind of pattern you want. He could make anything from scratch. And she was comparing me with her dad, who also had golden hands. So I started to think about it, and I started to think to myself, what is golden hands really about? And I want to demystify it. I want to break it down. When I was a new practitioner, this would have been great information for me to have, because it really sort of sounds mystical, okay? And it has nothing to do with that whatsoever. Now, before I actually break down and tell you what it is, you might say to me, hey Justin, you have over 20 years of experience with healthcare. You have training in 3 different styles of massage. Of course you have golden hands. And what I'm going to tell you is that it has actually nothing to do with that. So, what does it have to do with? It has to do with 2 things. Number 1, it has to do with always using correct therapeutic pressure, okay? And we're going to get to that in a second. And number 2, because I was working on Vermilion Orange's upper back pain, it has to do with using the patent-pending 4-step TrapEAZE technique. So we'll talk about that a little bit more also. But let's talk about using correct therapeutic pressure. So, if you're using incorrect therapeutic pressure, but you're basically doing one of 2 things. Either you're using, number 1, you're using too little pressure, or number 2, you're using too much pressure, okay? If you're using too little pressure, guess what? You're not doing anything, you're not accomplishing anything, you're not getting deep down into the muscle tissue where that pressure needs to be, okay? Now, if you're using too much pressure, number 1, you can injure the patient. Number 2, you can break blood vessels. I'm sure there's a few other things that you can do. So, moral of the story is you always want to use correct therapeutic pressure. And number 2, because again, I was working on Vermilion Orange's upper back pain, I was using the 4-step TrapEAZE technique upper back pain system. So you put those 2 things together and you get golden hands. So if you liked this video is a little bit of a departure from what I normally do, please leave a comment. I'm looking forward to hearing from you. Otherwise, everybody have a great day.